us. Dear participant, this is Imas Arumsari speaking. We are waiting for the participants for joining, so let us waiting for a bit. And thank you very much. And during waiting, you can make a notice on the slide sharing. There are some technical notes for certificate verification for your notice. Thank you.
Are you ready? Kita mandi. Kita mandi.
Once again, announcement for all participants. There are some technical notes for certificate verification. For Zoom audience, the participants need to use the Zoom display name as the same as name on the registration form so that we can confirm it for the certificate. And second, participants are not allowed to share the Zoom ID and password to others. And for registered participants on YouTube, please fill out the YouTube participation check form, which link was sent to your email. And participants need to leave comment during live streaming by format, name, and affiliation. For any question, you can contact our contact person and also leave the comment on the YouTube or Zoom. For any question during the webinar, if you have any question to our speaker, you can leave the comment on the chat and also leave the comment on the YouTube. Thank you. Dear participants, if you have any question to our speaker during the discussion session of this webinar, please send over your question and put it on the private chat, to our moderator, Muhammad Bikwanto. You can see his account, right? So the comment will not end up very much and the moderator still can see your question. Thank you.
Okay, yeah. Yes, you are unmuted by host. Okay, that's it. Bye bye. Bye bye.
So apparently our speakers and moderator already joined our room. So we can proceed to our event. May I confirm, Pak Big, you already here, right?
Yes, please go ahead.
Okay. So we can proceed to open this webinar. Okay, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Greetings from HSDH, ICSDH. Alhamdulillahirrabbilalamin. Wassalatu wassalamu ala asrafi anbiya'i wal mursalin. Wa ala alihi wa sahbihi ajma'in. Amma ba'du. For Honorable Dean and Vice Dean of Faculty of Health Sciences, Universitas Muhammadiyah Profesor Dr. Hamka. For Honorable Speaker, Professor Visit Chavasit from Mahidol University. Professor Purwiyato Haryadi from IPB University, and Dr. Derajat Martianto from IPB University, and all respected participants, we welcome you to ICSDH webinar, Food Security Policy Measure during COVID-19 pandemic, hosted by Faculty of Health Sciences, University of Muhammadiyah, Professor Dr. Hamka. This webinar will be led by our moderator, Bapak Muhammad Pikwanto, MPHM. For the efficiency of the time, I will give this form to the moderator. And don't forget to leave your question during the webinar by chat private to our moderator. Time and forum is yours. Thank you.
Thank you, Imas. Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullah.
So we will starting the webinar now. First of all, welcome to everybody to this webinar on food security policy measure during COVID-19 pandemic. As we know that food is one of the basic need of human. Since the world recovery from COVID-19 might take times, the world need concern about food security as well. So therefore, this webinar will be discuss the policy measure on food security during this pandemic. So this webinar is being organized and hosted by Faculty of Health Sciences, University of Muhammadiyah, Professor Dr. UHAMKA in Jakarta, as part of International Conference on Social Determinants of Health. We are very privileged and honored here to have very prominent expert panels joining us today. We already have Professor Fisit Shafasit here from Institute of Nutrition, Mahidol University. Professor Fisit, are you there?
Yes, I'm here.
Okay,
Hi.
thank you.
Good morning.
Morning, Mr. Visit.
So the second speaker, we already have here Professor Purwiyatno Haryadi as Vice Chair of Codex Alimentarius Commission. Good morning, Prof. Purwiyatno.
Good morning. Thank you for having me.
Welcome. And the last speaker is Dr. Derajat Martianto from Bogor Agricultural University. Good morning, Dr. Derajat. Are you there?
Good morning. Thank you for involving me in this very much important meeting.
You're welcome, Dr. Derajat. So the way we will do this, the webinar, so each panelist will deliver a presentation 20 to 30 minutes. Please see your time. And after our presentation done, we will open the discussion to all participants who has registered. So you can also submit your questions in the chat room as the webinar proceeds. So feel free to do that. We will do our best. Of course, due to the limited time, we cannot answer all questions, but we will do our best. So let me start with the first session. So I will read the CV of our first speaker, Professor Fisit Shafasit. He is the faculty member at the Institute of Nutrition, Mahidol University in Salaya. He graduated Doctor in Food Science from Department of Food Science and Technology from Oregon State University, USA. And during 2017 and to 2015, he was the Director of Institute of Nutrition in Mahidol University. And his research interests are on food fortifications and health food product development, which allow him to be consultant for many international organizations such as ICC, IDD, World Bank, GAIN, UNICEF, as well as Thailand Food and Drug Administration. So he has a lot of number of innovation and developments during his career as a professor and a lecturer. He's also a consultant from a private company. I cannot read properly because the name in Thai language. So welcome, Professor Fisit. You will share your presentation by your own, right?
Yeah, but how can I move my slide? I can move by my own the slide.
Yes,
It's okay.
yes,
I can share it for you.
Okay, yeah, thank you, Imas.
All right. So
Okay.
So over to you, Professor Fisit. Time is yours. 20 to 30 minutes.
Okay, thank you. May I have next slide, please? Yes, okay. I will talk about the food security, right? So before we start, we should understand what is the meaning of food security first. In 1996, you can see that food security exists when all people at all times have physical and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preference for active and healthy life. The term now you can see that in 1996 we talk about physical and economic access, and if you talk about the sufficient, safe, and nutritious, it means that you have quality and quantity of the food that enough to serve your healthy and active life. Next slide, please. In 2012, FAO changed the definition. The main one almost the same, but you can see that the term social access have been included. This is very important during the COVID, and we will talk about later. And when you talk about, in this case, the new definition, we talk about safe, consume in sufficient quantity and quality. The term quantity and quality is coming now to meet their dietary needs. So when you talk about dietary needs, mean that it's not the food security alone. It is a nutrition security. And then the thing is, food preference, this is the quality, right? And then you have to look at the environment, and then also adequate sanitation. And as well as, in order to have a food and nutrition security, you have to have a good health service and care. Okay, this is very important to make security of the food and nutrition. And this is a factor that we have to consider in terms of when we have the pandemic of the COVID-19. Okay, next slide, please. This is all the keywords. So if you have a food that have the quality and quantity that's good enough, you can have availability and accessibility, right? Then your body can utilize it and you can become healthy. And this one, if you have a good environment, you have a food that produced under the good environment, you make the system become stable. So food security and nutrition security become stability because of you did not destroy environment. Okay, next slide, please. Next slide, please. Imas, can we move to next? Yeah, okay. So in this case, you can see that food security can come quality. Quality means preference, safety, and nutrition. And quantity means that you get amount per meal is enough, and then number of meal is enough that to serve your need. So your body have enough quality and quantity for utilization and make you healthy. Next slide, please. So if the food is not secure, what happened? So the mind insecurity that you think that today I can have anything to eat every meal or not. So this is worrying. But moderate insecurity means that you have to compromise the quality to the quantity. So maybe you can eat the food that you don't like, but it's still enough, right? But if you have a severe, it means that you have to reduce the quantity and skip the meal. And very severe, you get hunger. So during COVID, if this one happen, it means that food is not secure. Okay, and if it long term, it's gonna be food and nutrition that's not secure. Okay, next slide, please. This one is very good. You can see that this describes the food system, right? And on this part, the pre-production means that you can do like learn how to grow or how to gather the food or how to get the food from the nature, right? So this is a farming and indigenous harvest. Conventional food supply need very long logistics before reaching the consumption. You can see that now in our country the same. You have processing, you have storage, you have the distribution, you have marketing, and then you can go to the consumer. Very long logistic. But if you can make it shorter from food source to the consumption, this is shorter logistic. In case of COVID, more logistic, the longer your logistic, you are at risk of food insecurity. But if you can shorten the logistic, the food gonna be more secure. Think about it. People who live in the city have very long logistic before the food reach into their hand for consumption. So they're gonna have more risk of the food insecurity rather than the people who live in the rural area who are close to the source of the food. So logistics is shorter. So that means that they have less risk of food insecurity. You can see that food system become more efficient if you can do waste management. Very good. So it means that food loss and food waste. If the food production here, normally COVID did not destroy the environment, so food production should be almost the same rate. Food should be enough for consumption. But when you have destroyed the logistic, you lock down the city, food cannot go for consumption, cannot go to restaurant, cannot go to the market. So it means that surplus is here, you cause the food loss already. And the restaurant or the hotel or any food store that store food aim to sell to the consumer, they will have the stock food that food loss. Okay. In case of the city, that you can see that when you have long logistic, people are afraid of food insecurity, and you're gonna have the term that called panic buying. The more panic buying may make food become insecure and become food loss or food waste more, because people try to accumulate food unnecessarily enough, unnecessary amount, until they can make the food loss also, right? So you can see this situation. But if you live in the countryside, in the rural area, you have access to the food source immediately. So people in this area may not have so much problem. Okay, next slide, please. Okay, so when we have city lockdown, you have social distancing, you have physical distancing, you minimize logistic for the food distribution. This one happened a lot to the people who live in the city. Next, please. Yeah, so you can see the Grab, right? People tend to order food by using Grab. I think in Indonesia the same. In Thailand, a lot now people who used to work in the office become the Grab. Next slide, please. Yeah, so the one that cannot afford it is the urban poor and the migrant workers. They come from the countryside. They come with the really stay with the low income already, but they don't have any income because the country locked down. This group of the people are affected a lot in terms of the food insecurity. The next one, please. Yeah, so many governments try to give their money. In Thailand also, they gave 5,000 baht for 3 months. But it's not the way that can be make the problem to be solved in terms of the stability or become hit to the point. Next slide, please. Or sometimes people have to work at home, right? So they get the free internet in order to order the food. It's not hit to the poor. It cannot help them so much. Next slide, please. Yeah. So in our culture, in your culture you have mosque. In Thailand we have temple or church. In Catholic they have church. In Thailand we have temple. So Buddhist monk is a part that they're still working. In this case, people still give the food to them, and normally the food that given to the monk is plenty. So next slide, please. So into the city right now, temple become place that people contribute food and give to the urban poor and the migrant workers. So they come to the temple to get the food every day, while they don't have any income to buy the food. So this is a part of to help in terms of the food and nutrition security in this situation, under this situation. Next slide, please. But if you look back in the background of the urban poor and the migrant workers, they come from the farmers. They are agriculturists. During this situation, many of them, if they stay in the city, they are at risk because the city is really crowded. They can be, lacking of food or something, and also they can have in terms of the infection. But if they go to the countryside, to their hometown, this one become diluted. This population become diluted because they go to the area all over the country, right? Next slide, please. So in this case, they come to the area that close to the food source, and their food security will be better. But how can we let them go home with no COVID with them? How can we screen them to back to the farm, to their own farm, by don't bring the disease from the city to their farm? Next slide, please. Okay, so if they're back home, we have to make sure that they have the strength in the community in order to do efficient screening and monitoring system, right? Next slide, please. Yeah, so in Thailand, I think in Indonesia the same, because we start almost the same time. We have the village health volunteer. 40 years ago, one volunteer taking care of 10 family, and then normally in the past 40 years ago, they're taking care of the problem of the malnourished, the protein energy malnutrition. Now they take care of NCD, and now they take care of COVID. So they join with the community leader to have the registration of the people who come back home. And then they hold them for 14 days before let them go into the community. And they try to monitor them if they have any fever or something like that and send them to the hospital if they bring the COVID back home. Okay, next slide, please. Yeah, so this is a way that, the WHO also like this system a lot. So village health volunteer, one person for 10 household, and then they go around to visit the household, and then they try to screen the people. Okay, next slide, please. Yeah, next slide, please. Yeah, so this is visiting, and then they try to advise them to stay home, and for 14 days. Okay, next slide, please. Yeah, so in this case, when they have in the community, we don't have exportation so much, and we don't have the tourists come in. So locally, they can live together by having the food in the community, and also they do bartering. The community that have like a fisherman, they don't grow rice, so they barter rice with the area that grow rice and grow orchard. So this is that happen in the community in Thailand, that they do bartering instead of do the business in terms of the momentary, in terms of the money. Next slide, please. Yeah, and when they go back home, in many cases, we have what they call community forest. We allow people who live in the community, and then they can take the benefit or get some product from the community, from the forest, by not destroying the community. This is the pattern that people in the community, they live for a long time for the food security. Next slide, please. Next slide, please. Yeah, so this is a thing that they get harvest from the community forest. So just like supermarket that close to their home. So this is when they go back home, they can be more secure in terms of the food security. Next slide, please. Yeah. Yeah. So we can promote them to do home gardening, in the rural area that they have some space, they do home gardening. So this is more security. You cannot do this one in the city. Next slide, please. Next slide, please. Yeah. So our community have the home gardening together. This one, even in the city, if they have the empty area, they can do it. Next slide, please. Yeah. Okay. Urban home gardening. Next slide, please. Yeah. And next slide. Yeah. Last but not least, this one, I think, this one is we call sufficient economy or new theory of agriculture. This is proposed by King Rama IX, the late king, our late king. So this is have been proven, and then UN accept it also. So if the new generation go back home and they have only a small piece of land, and they want to have food security with not much money involved, but they can have the food and nutrition security. They in the theory that the king have been proposed to us is you divided the land into 4 areas. The first part is a pond or reservoir. So this is a source of water, and also they can grow fish. And also the part of orchard, the part of rice field, and the part for settlement. So in this area, if you divide it properly, you can have all the food that you can serve the nutrition needs by don't have to buy anything from outside. And this is a very good food security in terms of something that emergency or food emergency, or in terms of COVID or whatever. People can live by their own without without being affected from outside. Next slide, please. So this concept have been proven even the small area, and people can survive. So this is the thing that I want to propose, that if the people who are urban poor or migrant worker in the city want to go back home, they may not go back to the city. And the way that they can start agriculture with this theory is very stable, and I think it's very secure in terms of the food and nutrition. Thank you. Next slide, please. Yes. Okay. Thank you.
Okay, thank you, Prof. Visit. That's very excellent presentation and very interesting because you said that the food is not just a matter of quantity, it's also a matter of quality. And also you mentioned about the sustainable for the environment because a lot of the industry is not thinking about the sustainability for the environment. But the interesting thing is the barter system. It's like a back to ancient world.
Yeah, that's true.
You don't have money, but you have something to, offer others, so you can just barter to others. So this is very interesting because I never heard this kind of situation in Indonesia, but it is happening in Thailand. And I understand that your country, Thailand, has a vision to become a kitchen for the world. Am I right? And I know that your agriculture system and reformation is very well. So this is very interesting. So maybe we will wait for the question from the participants. Thank you very much, Professor Visit.
Yeah, thank you.
So the next is Professor Purwiyatno Haryadi. He is a professor in food processing and engineering at the Department of Food Science and Technology at the Faculty of Agricultural Engineering and Technology in Bogor Agricultural University. So he's received his PhD in food chemistry with minor in chemical engineering from the University of Wisconsin-Madison, USA in 1995. Long time ago, Professor. He is a member of
I'm old.
He is a member of Codex National Committee. Maybe you can mention what is Codex National Committee later when you present your presentation. In 2010, and in 2017, Professor Haryadi was elected as the vice chair of Codex Alimentaris Commission. Prof. Haryadi also the chief editor in monthly magazine Food Review Indonesia, and his research interest in the area of post-harvest handling and processing, especially for palm oil and food processing and engineering. So over to you, Prof. Purwiyatno. Time is yours. Thank you.
Thank you very much. I would like to share screen, but it says that
maybe host can help?
Yeah, can help me because it says the host disable participant screening sharing.
All right. So we wait for Imas to help.
Okay, thank you very much. Thank you very much and good morning, ladies and gentlemen.
So Imas, can you respond?
Sorry, Prof. We haven't received your file yet.
Yeah, I would like to share it.
You can send it to us, maybe by WhatsApp, because we haven't received the PowerPoint yet.
Can I share it by myself now?
Yes,
I think it's easier.
Course. Yes.
Yeah, I will send it later on.
So Imas, you might need to reminding the host to enable the feature of screen sharing, because the screen sharing feature is off by the host.
Yes, sure.
So please mention the host.
We already stopped the screen sharing. So Prof. Pur, you already can share your screen actually.
Yes, thank you. Now I can.
Okay, good.
Thank you very much.
Welcome.
Thank you. Can you see the slide now?
Yes.
Okay, thanks. So this is the technology. Thank you very much. And again, good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
I'm honored to be here today, joining the with
I think we lost the connection with Prof. Purwiyatno. Hello, Prof. Are you there? Hello, Prof. Okay, so we have a problem with the connection. So I think Prof. Ruwiatno need to enable atau stop the video in order to get a good connection. Hello, Prof. Are you there?
It was disconnected, is it?
Yeah, I think so.
Okay. Okay, sorry about that.
Okay.
And, okay.
Yes,
So
continue.
again, I would like. Can you hear me?
Yes, please.
Okay. Yeah, thank you very much. So again, thank you for the opportunity. So I will start today discussion with noting the fact that on March 11, the WHO has declared the COVID-19. So the disease continue in the sector.
Prof. Pur, I think we got problem with the connection again. Can you hear me, Prof. Pur? Something wrong with the connection, so we couldn't hear you.
But hello?
Hello, yes, Prof. Pur?
Yes, okay. Well, sorry about this. And okay.
Okay.
So again, I will start with the fact that WHO has declared the COVID-19 pandemic since March of 11. And since then, the disease has impacted almost all aspects of human life and also industrial sector globally, including the food and agricultural sector. And one of the main policy of the government in dealing with the COVID-19 outbreak or pandemic is to develop a protective measure to flatten the curve, to slow the spread of the viruses and to prevent the healthcare system from becoming overwhelmed. And this usually done by way of minimizing movement of the people, encouraging people to stay at home, to work from home, to study from home. And essentially now, we witnessed that the whole world is nearly in isolation, stay at home, teleworking, and so on. Lockdown, or in the case of Indonesia, is large-scale social restriction, or PSBB. PSBB policy is widespread. With this kind of policy, clearly, there is a need to take into account the wider impact of interaction with other sectors, including the agricultural and food sector. In this policy of lockdown or PSBB, some countries have even ordered the closure of national border and the closure of business activity. Obviously, the impact of large-scale social restriction or working from home policy on food security and nutrition need to be well anticipated and mitigated. I think we all have to remember that working from home is not an option for food sector. You cannot produce and distribute food by working from home. Producing food and maintaining the movement of food or distributing food along the food supply chain is really a critical element of the food security. Talking about food security, then we need to be concerned about the food safety. As stated by FAO, that if it is not safe, then it is not food. So first thing first, food has to be safe. And we're talking about the food security has to start with safe food. Fortunately, I may say, with respect to COVID-19, a risk assessment conducted by various authoritative food institutions in the world shows that it is very unlikely that people can get COVID-19 from food or food packaging material, meaning that COVID-19 is not a foodborne disease. This is assessment out from US FDA, US Food and Drug Administration, mentioning that currently there is no evidence of food or food packaging being associated with transmission of COVID-19. And then also from European Food Safety Authority, very much the same, that coronavirus, there is no evidence that food is a source of or transmission route of coronavirus. The same thing coming from Canada, Canadian Food Inspection Agency, mentioning that there is no evidence to suggest that food is likely source or route of transmission of the virus. The same thing also again coming from Food Standard Australia and New Zealand that come up with very much the same conclusion. And according to FAO and WHO, from their risk assessment activity, also mentioned that it is highly unlikely that food can contract COVID, that people can contract COVID-19 from food or food packaging. Here in Indonesia, we also have risk assessment that has been done by the BPOM, National Agency of Drug and Food Control, and come to the conclusion that the risk of transmitting COVID-19 through food and food packaging is very low, as long as the good manufacturing practices is implemented by all industrial sector in each of the supply chain. That's about the safety. And now move to the fact that food system has important tasks in fighting this COVID-19 pandemic, especially to provide safe, nutritious, and quality of food supply for the population, so that the population has a good endurance to fight COVID-19. As advised by health authority such as WHO, good nutrition and healthy diet are essential to boost immune system. So in this situation of COVID-19 pandemic, we really do not want to see the worsening of food security, because this may cause the progression of the pandemic by weakening immune system of the individual, reduce the ability to prevent and fight COVID-19. So we don't want to see that. Furthermore, not only that, about the nutrition and also about the immune system, by nature, food is essential for human life itself. Basically, people will not be able to survive without food. Furthermore, food shortage has been identified as one of the root causes of many social problems. As stated by the Norman Borlaug, this is a Nobel laureate, mentioning that peace cannot be built on empty stomach. Therefore, the government and all stakeholders must ensure the food security for the population by ensuring the well-functioning of national food system to feed the nation. So now we come to the food security and COVID-19 itself, and how are we doing before the pandemic itself? The fact is that according to the publication issued by FAO, IFAD, Unicef, WFP, and also WHO in 2019, the state of food security and nutrition was already alarming, actually, even before the outbreak of the COVID-19, even before the pandemic. As we can see, this is one of the alarming figure. There were 821 million chronically undernourished people in the world last year, up from 811 in the previous year. This is very, very alarming. Hunger is also in rise in our region as well. So the upward trend of the world hunger, as we can see here, based on the percentage and also the total amount, after a decade of steady decline, yet underscored the immense challenge of the achieving food security that we all would like to have. The number of hungry people in the world is back up where it was nearly a decade ago. The world is not currently on track to meet the goal of ending hunger and ensuring food security for all. And we really concerned about this. This food insecurity rate are expected to worsen as a result of COVID-19 pandemic, indicated by increased number of undernourished people in the world. And the poor people living in the remote area, as suggested by Dr. Visit before, migrant worker, and also the informal sector people, especially people in the conflict zone and other vulnerable group, is likely to face the worst consequences of the food insecurity. The disruption of food security by COVID-19 can occur because of many factors. Yeah. Among other is because of the producer or the worker in the agriculture and food sector become sick. When they become sick, they cannot work. They cannot produce food. So number two, worker mobility are hampered by the lockdown or by the large-scale social restriction policy. They cannot move freely. They cannot sell food very easily. And then number three, workers are worried about being exposed to COVID-19, so they may choose not to work instead. So again, this will reduce the food availability itself. And also other potential disruption of food logistics, warehousing, transportation, distribution, and also retail activity, especially in the area affected by COVID-19. There is a delay probably or cancellation of order, panic buying has been mentioned by Dr. Visit, for example. So all of those can impact our food security. And also, several countries are increasingly imposing export ban on food or other products as a means to shore up their domestic supply during the coronavirus pandemic. So what needs to be done? In my opinion, at the national setting, national initiative, government will need to support food supply chain and avoid disruption in the food movement and trade to ensure that the function of food supply chain is smoothly and will not have any disruption. It should be noted that national food supply chain now is also closely linked with the global food supply chain. In this case, it is important to ensure that both worker and input necessary for food and agricultural production be able to move freely, to circulate freely, to assure that the production process in the factory, for example, and also at the land will become smoothly done. Furthermore, government should seriously consider to improve the efficiency of food supply chain by, for example, among other things, applying the artificial intelligence technology, like blockchain technology has been mentioned, to assure that the food can move very fast and also very efficient. Government need also have in place policy to empower small-scale medium enterprises. Government should support local community and citizens to increase the local food production, including home and also community garden, through appropriate stimulus package, can be cash or in kind, to enhance the food security at the local level and also to minimize food waste and avoid overbuying, panic buying to assure better food security. Government should also provide guidelines tailored for food workers involved in food production, handling, and processing to help them avoid catching and spreading the COVID-19. Government also need to identify alternative food sources as an alternative national food source. For example, like sagu, cassava, or many other things. Government also need to work together globally to strengthen cooperation during this pandemic that is affecting all regions of the world. And this has been explicitly expressed in the joint statement of COVID-19 impact on food security and nutrition issued by FAO, IFAD, and also World Bank and WFP in the occasion of the extraordinary G20 Agricultural Minister meeting in April 2020. The joint statement recognized, among others, that agriculture and its food-related logistics service should be considered as essential. So this is very important. So with that consideration, increased effort are needed to ensure that food value chain function well and promote the production and availability of diversified, safe, and nutritious food for all. The joint statement also stated that currently the world food market is well supplied. So the supply is there, and also all countries also have food production capacity as well. So the export ban and rapid escalation in the food stock procurement through import will exacerbate the market disruption. So we don't want to see that. Again, the joint statement also realized that countries need to work together to strengthen cooperation during the pandemic that is affecting all regions of the world. It is important to ensure that national policy, such as short-term measures to restrict trade, we need to be sure that this kind of policy will not distort a global market. And furthermore, that collective action is needed to ensure that markets are well functioning and that timely and reliable information on market fundamental is also available to all. So I think government need to collaborate to keep global agricultural and food trade open and well functioning. And with respect to international food trade, government need to establish measures that appropriately protect human, animal, and plant health in their territory. This is very important to ensure safe and efficient food supply chain, especially during the COVID-19 pandemic. And this is where Codex Alimentarius Commission have an important role to play. As we know, in general, Codex was established in 1963 by FAO WHO with mandate of developing international standards, including guideline and code of practices to protect the health of consumer and also to ensure fair practices in the international food trade. With respect to the international food trade, food export-import is essential component of global food security. Obviously, food import by country in need will ensure or improve food availability, important component of food security. And food export is also important component of economic growth of the exporting country. Important for foreign exchange, generate income for small producer, ensure employment in the rural food producing region, and also improve food purchasing power. However, trade, especially trade of food, may potentially carry some degree of risk to human health. In order to reduce this risk without causing unnecessary restriction to trade, then Codex standard was established and adopted by the member country. So these are some of the guidelines that can provide a framework for the development and operation of import control system to protect consumer and facilitate fair practices in the international food trade while ensuring unjustified technical barrier or trade are not introduced by any country. This number one, this is a guideline for import, food import control system. And then we also have a guideline for the design, operation, and assessment and accreditation of food import and export inspection and certification system. This guideline help government build and maintain the necessary confidence in the inspection and certification system of an exporting country and facilitate fair trade. So this is also very important guideline. And for inspection certification with the consumer protection and facilitation of trade. Number four, this is a principle and guideline for the exchange of information between exporting and importing countries to support the trade in food. This guideline is also very important provide guidance to help simplify and harmonize the information and the process of the exchange information itself. And the fifth one, this is the last guideline that Codex has developed, guideline for the design, production, issuance, and use of generic official certificate, recognizing that official certificates should only be required to ensure that food safety and or fair practice in the food trade requirements are met. So this is a very important. This guideline apply to official certificate regardless of their mode of transmission. It can be paper certification, and also it can be electronic certification. As we know now, in the context of COVID-19 pandemic, the issue of paperless or electronic certificate is very important. The Codex is also developing this guideline now. So this set of document of Codex are example of where Codex may facilitate fair practices of import and export system while protecting the health of consumer everywhere. So as a conclusion, we know that the priority of the government around the world now is to protect the health of their population through strict border control, traffic restriction, for example, both within the country and also across the border. However, the government in taking that kind of policy have to take into account the broader impact on food security and nutrition, especially at the global stage. Just like management of COVID-19, addressing the COVID-19 impact, which is food security in our case today, also required globally coordinated response to ensure global agriculture and food trade remain open and well functioning and in a fair way, and still able to protect the health of consumer and not to disrupt global food supply. With that, I would like to end my presentation and thank you very much for the opportunity and for the attention. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you very much, Prof. Purwiyatno. It's very excellent presentations. So you mentioned that actually work from home is not option for food sectors. And we have a good news because there is no evidence that food as the source of transmission of the virus. So don't worry too much because sometimes I did also like washing too much food from the market. So this is a good news for all of us. And also you mentioned about the potential of the disruption in the food sector and the recommendation for the government. So we are relying on government policy actually very much. So this is very important for us to, you know, like pushing the government to do the good recommendations and the policy for food sector. Okay, thank you very much. I will remind again the participant, if you have any question, please send me your question to the chat room privately. So I can read your question later in the end of the presentations. Okay. Okay, thank you, Prof. Purwiyatno. So next, we will go to Dr. Derajat Martianto. So Dr. Derajat Martianto is Vice Rector of Education and Student Affairs in the Bogor Agricultural University since 2019 until now. And also he is a faculty member of the Department of Community Nutrition, Faculty of Human Ecology at the Bogor Agricultural University. So Dr. Derajat will deliver presentations on COVID-19 impact on food security in Indonesia specifically. Okay, thank you very much. Time is yours, Dr. Derajat.
Okay, thank you very much, Pak Bekwanto. Good morning, Professor Visit and Professor Purwiyatno, and to all of you, all participants. Morning, Assalamualaikum warahmatullahi wabarakatuh. May I share my...
Yes, please.
Okay, sorry. Can you see my presentation?
Yes, very clear.
Okay, thank you very much for inviting me to join with all of you to share and to discuss the possible impact. I said the possible impact of the COVID-19 to food and nutrition security in Indonesia. And this is the outline of my presentation. I will just show brief the magnitude of our problem in COVID-19, and then the relationship between COVID-19 and the food and nutrition security, with the special case in Indonesia, of course. And then we will discuss who actually the most affected people in Indonesia, and to be given priority for the policy measures to avoid food insecurity, of course, and then the relevant policy and intervention needed, and what will be the post-pandemic strategy we need. Actually, our cases, if we compare to other countries, for example, United States and Italy and so on, is still much lower. But 3 days ago, at least more than 15,000 people in Indonesia has infected by the disease, and the death rate, the death toll is more than 1,000. And some people believe that the situation is the statistic is actually underestimated. We do not know exactly, maybe because of the coverage of the test. But the problem is the main problem is that the cases in Indonesia is still increase. We do not know exactly when will be the flatten curve will be happen. Some people predict maybe in the end of May. Others predict June. Hopefully, it will finish on by June. And then actually, Professor Visit and also Professor Porwiatno has already mentioned about the possibility, the framework where the COVID-19 will influence the food security, or to create food insecurity problems. I think all of the people in the who learn about nutrition is already very much familiar with the Unicef Framework. According to the Unicef Framework, malnutrition is caused by two direct factors, which are inadequate dietary intake and also infectious disease. And the basic causes is usually political, ideological factors, social conflict, economic structure, economic failure in the development of country development, for example. But in this case, what we will discuss, the root causes is actually what we call as disease. This is not immediate causes of malnutrition, but this is lead to the very wide spectrum of problems in every country in the world, what we call as COVID-19. So it is also actually briefly has been discussed by Professor Visit and Professor Porwiatno how the COVID-19 pandemic serve as the root causes of many problems, because it will limit the people activities, people movement from one to other places, and then it will hamper the economic activities, hamper the transportation and logistic, including food, although transportation and logistic of food is become one among the exempted. And the other problem is it will create the production problem also, because of people know limited activities outside of their home. And as Professor Porwiatno mentioned, that it is the kind of activities, it is the kind of business that we cannot do it from home, because most of the people is using a simple strategy, particularly in Indonesia, in their food production. We cannot control using artificial intelligence, for example. So we still have to go to the field to produce food. And unfortunately, we just received information from BMKG, or the Office of Climatology, Climate, that mentioned that soon most probably early June, we will face a longer and also dry season. It will also in combination with COVID-19 pandemic will really create a big problem for the food production in Indonesia and also for the food supply in Indonesia, I think. So if we look at the back, if we look at 1918, for example, during the pandemic of Spanish flu, we call it in Indonesia flu Spanyol. It was also the combination between the flu Spanyol and also dry season at that time, and that's make food security in every country. In many countries face a very very poor situation. So the framework how the pandemic COVID-19 serve as root causes to create a shortage or reduce in food supply and stock, to reduce food access and reduce the agribusiness profit, and it will increase the poverty and also reduce the food share expenditure. Actually, briefly can be seen in this slide. You can learn more later on because of the time limitation. But briefly, this situation will, of course, finally affect the nutritional status of the people, particularly with their limitation of capacity to buy the high quality of food. Micronutrient deficiency, hidden hunger will be increased sharply, the prevalence. And also, of course, stunting that our prevalence is still very high in Indonesia, as well as underweight and wasting, it's become problem. And most probably even overweight can be also become a problem also, because there is a trend that people for their coping strategies eat more carbohydrate rather than high quality food, such as vegetables and also fruits, because of the high price of those high quality of food. So there will be a big problem if we do nothing. So, but in this opportunity, I think the topic of our term of the discussion is what are the policy measures needed to at least to reduce the negative effect of the COVID-19 pandemic. Okay, I will just give you the information. This is the data is got from Ministry of Economic and Finance and also the Ministry of Agriculture. You can see that the situation of food supply in Indonesia, particularly for the 11 what we call as strategic food in Indonesia. Yeah, that until June, the balance is still positive. That means that until June, we still have sufficient food. The domestic rice stock is more than 6 million. And then that means that at least for 3 months, it is still enough, because you know that Indonesian people consume rice approximately 2.5 million metric tons per month. So with 6.4 million tons, it is able to serve for 2.5 months. And maybe in August, we will have a new production around 1.8 million metric tons. And then that's mean that we will have enough rice until October from our stock. But after that, we will have a problem. If we do not have enough food, for example, if the importation is hampered because of not only for the logistic problem, but also for the changes policy in the exporter country. For example, Thailand has already stated that they will not export the rice, their rice surplus. We still do not have information whether Vietnam, Myanmar will also following the Thailand policy not to export their rice surplus. If that is happen, then we really have to think very hard how to fulfill our need on food, particularly the staple food, because the next harvest will be on January, February, or March in 2021. So we still have to take care of this problem. And therefore, the staple food diversification should be prepared since importation of rice may be not possible. And actually, as Professor Parwiatno has already mentioned also that the global cereal stock is tend to decrease as well. So we have certainly we have to say that the global situation is not better than our country situation. So we have to use this opportunity to really thinking what we have to put in our policy for the next food policy. Yeah. Okay. So these figures show you some interesting information. In the middle and the right upper figures, you can see how strong the income will affect calorie or this carbohydrate intake, energy intake, as well as the protein intake to the people in Indonesia. What does that mean? That means that if the COVID-19 create a shock of our economy, create a shock of our income, then it will create a food insecurity problem, particularly among the poor, because the poor is among the most what do you call the most infected groups. And you can see in the left side that in the last 4 months, January to April, in Indonesia we call it nilai tukar petani. This is an index of the farmers' welfare to show the what do you call exchange of the farmers, the welfare of the farmers decreased sharply, yeah, because of this problem. So that's and and all of us know that Indonesian people, 30%, almost 30, more than 30% of Indonesian people working at the agricultural sector. So the situation will really give a big impact to at least 1/3 of the population because their welfare is decreased, and then maybe their capacity, their purchasing power, capacity to buy food is also limited, and then we will predict that the energy intake, the protein intake will reduce as well. And the bottom of this figure show you that yeah, the higher the income, the better the quality, and the lower the income, the lower the quality of food consumption, as indicated by the expenditure of each quintile. So that's mean that if there is an income shock among the people in the villages or in the urban area because they lost their jobs, they lost their business, etc. So food insecurity will, food security will have a big challenge. Okay. This figure gave us the information regarding who are the most affected group based on economic class and sectors. The high impact will be received by the hotel, restaurant, transportation, and so on, as has been mentioned by Professor Visit. Yeah, in the left side, you may see that we have around almost 10% of the poorest people in Indonesia, and the near poor is almost 20%. And a new middle class is around 46%. We all know that the new the potential the new middle class and also the middle class contribute to very high to the national national consumption, not only food, of course, and also the tax. So if the economic hit them, there will be a big problem because some of them will back to the we call it uh, Camila, yeah. Camila is kembali miskin lagi. And then there will be a new poor also who come from the near poor. So this situation will really to be put into consideration. Our policy should be directly able to protect all of this, particularly the poor and the near poor community, to not to be able to still, yeah, me to access food by assistance of the government and also assistance of the higher income, particularly from the have people. So we have also to, so that means that we have to create a nationally, not only social safety nets, but informal social safety net is also supposed to be encouraged. We have to encourage the people to take care of other people, to take care of their neighbor, yeah, as a potential assistant of the informal social safety nets. Okay, this is the data about the undernourishment that Professor Parwiatno has already mentioned at the global level. You know that actually during 2015 to 2018, we have already achieved very remarkable progress. In 2015, for example, our POU, prevalence of undernourished, the indicator of POU is just simple, that people who do not able to consume 70% of their RDA, the requirement for energy, that is the simple definition. We have a 14% and sharply decreased in 2018 to become only around 8%. But we still do not the data yet for 2019 and 2020 during the pandemic, but it is expected to turn back, to increase if we do nothing or if we do not have a effective policy to prevent that. On the left side, you can see that in 2018, our food security and vulnerable atlas show that the vulnerable areas in Indonesia is mostly in the eastern part of Indonesia and some part at Sumatra and also Kalimantan and all of the Javanese island areas is green. But we do not know what will be the appearance in 2020 because you can see that most of the people who are living in Java is affected by this problem. You know that Java is now the most populous people, but it is also known as the central for the food production. So if the food production is affected, then the welfare of the people will be affected as well. And also most of the Japanese people, the young people, the millennial groups working on industry, on business, if businesses do not working, and then they will be affected. So it is our challenge. Yeah. So it is important to the government and also us, the society, to prevent the worsening situation of the impact of COVID-19, of course. In this left side is the figure, what are the government doing now? The government of Indonesia spent a very big amount of money. That's around 405 trillion rupiah. That's almost 1/4 of the total our what do you call national budget. And among them, 75 trillion is for handling the COVID for the health sectors. 110 trillion rupiah is for the social safety net and tax incentive and also the incentive for the small and medium enterprises to be able to cope with the situation is around 70.1 trillion rupiah. And then economic incentive to make business still running, although running, yeah, that's around 150 trillion rupiah. So this is, if we do not do this, then there will be a big problem. According to Bapenas, there will be around almost 5 million, no, almost 4 million new poor people will appear in Indonesia. Then it should be prevented. So all of this measure is affected to be able to prevent additional of the poverty level in Indonesia. And if we do these measures, it is expected that the poor poverty is only increase, yeah, very small, from 8.9 to become 9.24 only.
I'm sorry, Pak Derajat, your
Okay.
time, 5 minutes.
Okay, and that's we have 3 more slides. Okay, and then this is the things for the government that should be also taken into consideration. We during the COVID-19, we still have also to pay attention to put the what do you call the priority for the nutrition programs. Food fortification has been proven as the most cost-effective to handle the macronutrient deficiency or hidden hunger. So we have to still continue this program, particularly for the under 5 children, to introduce again the sprinkle tapuria, and also to maintain the staple food, because staple food fortification, because we have a problem with the logistic potassium iodide, and also premix is hampered by the logistic problem from Malaysia, from India. So we have to tackle that. And also home gardening is become very much relevant now, as already mentioned by Professor Visit also. Food supplementation and nutrition education, the good and the exact and the clear nutrition education through social media is very much important now, because there are so many hogs around us, yeah. And then, okay, the other thing, the important thing is we have to help the farmers that find difficulties in sell their in marketing their products by shorten the what we call as the what do you call supply chain, by shortening the supply chain and developing the online business for the small farmers, for the local areas or even the national areas. We will help them to remove the middleman and to increase their welfare, and also give a good price, good quality for the consumer. And we have to help them to make they are closer with the off-takers to be able to absorb their food production and maintain the food supply to the people at the urban and suburban areas as available. And as closing, I think there are things that should be changes in our country in Indonesia. The first is the government should implement the sustainable food system strategy. So our food planning should be integratedly, not disaggregatedly. So we have to, we have already developed the system, as you can see in the bottom of this slide. I think a sustainable food system supposed to be implemented. And then the second is, if we talk about the consumer role, the consumer supposed to change the food pattern and more ways to use food to reduce food loss and waste. As to change, we do expect that we will consume lower rice per capita. Now it's still 100 kg. It is the highest rice consumer in the world. So we have to reduce this until 50 or 50. No, I'm sorry, 80 or 85 per kg per capita per year. I think with that, we will no longer import rice, and even we can export rice if we can reduce our consumption from 100 to 80. And 80 is enough according to Pola Pangan Harapan, the Desirable Dietary Pattern. And of course, we have to reduce wheat and substitute with the locally produced food, such as sagu, cassava. We have to back to nature, I think. And then also to consume the higher vegetables and fruit intake. And online buying for the farmer-based supplier. And the most important thing is also that I saw reminded by Professor Visit also, is wise food consumption to reduce the food loss and also food supply. So that is all of my presentation. Thank you very much.
Thank you very much, Pak Derajat. It's very excellent presentations. Very interesting in the last slide. We have new normal for food intake. So, lower food rice consumptions, back to, our old consumption like cassava instead of imported food. Also, you mentioned about the importance of home gardening. So this is very important because we need the, good food consumption during this pandemic. So thank you very much. So I got a lot of questions from the participants. I hope I can able to deliver all questions to you all. So I will start with the first questions from Nurul Dina Rahmawati. The question for Professor Visit. Because of the limited time, maybe you just need to answer very shortly.
Okay.
She asked about how about the meat, poultry, and dairy milk products supplied there in Thailand? Because she is impressed with the way your people try to plan on their own. So how about the meat, poultry, and dairy milk product supply in Thailand?
In fact, you have to accept that COVID did not affect so much on the food production at this moment. So the food are produced at the same way that they used to produce before. The problem is the logistic. So right now we have a direct order or online order directly from the farmers or from the company or the slaughterhouse. So it's no problem at all, and the production rate is still the same. The thing in future, if this one's still going on, the next season we don't know what's gonna happen. But right now, it's no problem at all.
Okay, so the problem is the logistic. Okay, thank you very much.
Yes, so now they can do online.
Okay. Okay, the next question from Teresia Sanubari. I would like to ask Mr. Visit. Urban garden is one of the interesting solutions for the prevent food insecurity.
Yeah.
My question is how to empower society to do it, because maybe society still don't have information access how to do it properly.
In fact, during the crisis like this, people have to stay home, right? So most of the people stay home. They spend more than half of them maybe work at home, but another part they still can do something else. So this is a way that you can teach people how to do the urban gardening. And also, I encourage people who come from the rural area to work in the city to go back home and then try to look at your own area. That if you are farmers, you have more secure. Money is not everything. Food is something that you can touch. Money is not thing. If you don't have money, it doesn't mean that you die. But if you have food, if you don't have food, you die. Okay.
Maybe we need to start campaign on home gardening, how to do it from the scratch. I mean, this is our task to do. Thank you very much, Professor Visit. So the next question is for Professor Puriyatno. What kind of food that must be designed by food technologists to anticipate situation like pandemic COVID-19? Because of pandemic COVID-19, is there a possibility to change Codex standard to support the building of immune system and food security? Prof, you need to unmute your microphone. Maybe host can help to unmute Professor Puriyatno microphone. Imas, can you help?
Thank you. Thank you. Yes. Yes. As far as the standard is concerned, standard is usually will be revisited, will be revised if the science and technology regarding the food safety related to the food product, a certain food product has changed, or if the result of risk analysis regarding the level of risk associated with the food is also changed. With respect to the COVID-19, as I mentioned before, that COVID-19 is not a foodborne, meaning that it will not impact any standard related to food because it's already being taken care of by itself. So far there is no evidence that COVID-19 can be a foodborne. If it is a foodborne, then there is a chance that we need to review the current standard, but we don't need to do that right now. As far as the rate of consumption is also very much remain the same. So we don't need any, we don't see any need to change the standard. But with respect to the immune system mentioned about the functional food, for example, there is a growing interest right now, but we don't have a specific standard on functional food, but we have what we call it as a health claim standard. So if the science is there, so the health claim can be developed.
All right. Okay, so the standards is still relevant during this pandemic. Okay, thank you, Prof. So the next question is for Professor Visit again, from SIPA. As we know, there are several indicators and methods for measuring food security. Like in your slide, there is household food insecurity assess scale. When we would like to do the research for assessing the status of food security and deciding household who is secure or insecure to make the intervention or program is more effective and efficient is right on the target. Do you have any suggestions? Which one is better methods and indicators for assessing status of food security in urban area when COVID-19?
FAO have the method that we call FEAS, Food Insecurity Experience Scale. Okay. That one you can do the measurement very easy. If you have the food that can fulfill your need in terms of the quality and quantity, that one is you have secure. If you have to compromise the quality for quantity, that one slightly insecure. If you have to compromise both, it's not secure, something like that. Okay.
Okay. Thank you, Prof. Okay. The next question: how if the person who produced that food infected by COVID-19, but he or she doesn't know that she or he is infected? So is the food still safe? Maybe this is the question for Prof. Suryatno.
Yes, thank you very much. So COVID-19 is very much about the people. So the people who produce food is not necessarily linked to the food that they produce. So this is the first thing. That's why I mentioned so far there is no evidence that food and also the packaging of food is associated with the COVID-19. We heard that there is some research mentioning that some surface like plastic that usually used to package food and also some stainless steel can support the life of the virus, or in this case a coronavirus. And they can stay there maybe for several hours and even several days sometime, but it's very easy to be inactivated. As you know, in the processing of food, usually heat is used. So if, for example, the residual virus is there, so it's very easily inactivated by the food processing setting. So if you look at the guideline issued by FAO and WHO, then there is no such need to recall food that are being produced by the people who got infected. But the people is the one that need to be taken care of. So how to do the physical distancing during during the food production. It's very important. This is not so easy, but it's very important. And also implementation of good manufacturing practice, personal hygiene. And if you look at the good manufacturing practice, for example, one of the important thing is checking the health of the people. So if the people is sick, then the people should not be at the vicinity, at the facility of food processing. So if all of that measure is done properly, so I think we don't need to worry about the safety of the food. What we need to worry right now is the safety of the people who are producing the food.
Okay. Thank you very much, Prof. Okay, the next question is from Teresia Sanubari again. To Pak Derajat. From your perspective, how to bring nutrition information to remote group in pandemic condition, and who should do it?
Okay. So I think if we look at the statistic of the what do you call IT users in Indonesia, it's most of the people in Indonesia, even in remote area now, have the gadget to receive the information. So it is of course there is areas that blank spot, etc. Yeah, but most of the people in Indonesia has already connected now, and of course, who are the most responsible for to do this? Of course, us. We are in the university. Those are from the government, Ministry of Health, the local government also. I think all of us who have good knowledge, who have what do you call competencies, have our responsibility to educate other people.
Yeah,
that's a part of ibadah, right?
Yeah, all right. So I think the nutritionists need to learn how to
Yes, of
communicate with people, to do a campaign, to do home gardening. And it's very important because you don't have that skill.
You're right. As Professor Vietnam mentioned before, that we have to work together with other people, with other countries. Do not thinking that nutritionists are also a good communicators. So we have to working to join together with the communicators who has ability in designing the message and so on and so forth. We have the knowledge, but maybe we do not have the capacity to make it into the very interactive or very attractive message. So we have to join to work together with collaboration is the key.
Okay, thank you, Doc. Other question for you from Ibu Sofian Infinira. What is your suggestion to shorten supply chain to improve environments, farmer incomes, and fair price for consumers?
Yeah, actually, you can see on my presentation. Yeah, before I just give a simple example. I'm living in Bogor, and the vegetable is usually come from Puncak, from Bandung. It is very long trip to go from Puncak to or from Bandung to Bogor. Before going to Jakarta, it's a stop at Bogor, and then change the vehicles to bring to Jakarta and so on and so forth. You can imagine what is the cost of that. What is the carbon dioxide produced? Yeah, what are the food loss from that? So the farmer is working the hardest, but gain the lowest. So in this situation, we just learn the benefit of the not the benefit, the good things that we can learn during the COVID-19 is no, we understand that urban farming, the suburban farming, the local distribution of food, local logistic is very much important. It is not only good for the farmers. The shorter the way, the shorter the what do you call? So if you can shorten the distance between the farmers and also the consumer, so you can imagine how efficient is the system, and you can imagine what are the costs of the transportation, the logistic can be cut it, and then it will increase the consumer welfare, as well as, of course, the most important is also farmers' welfare. So we have already practiced that. We are working with 100 villages in the West Java, for example. This is the case of IPB. We have already working with the 100 villages. We create the BUMDES as a good company, village company. It is very good for the village situation, because now the trend is deurbanization. So people who are losing their jobs in the cities go back to the villages, and they do not have jobs. And so it is a very, very challenging situation. So the idea is how we can create a new job at the villages by involving the deurbanized people with these activities. They can join the BUMDES, they can join the business in agriculture, and they can get benefit either in production or either in the transportation, in the delivery, and so on and so forth.
Okay, thank you very much, Dr. Derajat. So I will back again to Professor Visit. The question for you: a strategy, one volunteer for 10 households to cover health status in the community. Who are they, the volunteer? How can you select them? So Professor Visit, you need to unmute your microphone.
Yes, they are volunteers. So there are people in the village that they would like to learn about public health. I think in many countries they have this policy. So they are trained very simple in terms of the public health, that like a household medication or something like that. And so these people are trained. We have this system 40 years ago when we have the problem of protein energy malnutrition. And this group of the people went to each household to do the survey. They do very simple measurement in terms of nutrition. For example, weight, height, and give the advice to the mother how to eat right correctly and make the contact when they get pregnancy, for them to go to check at the local hospital or something like that. So this is the system that we have before. So this one, they have network already. So when we have the system, we can do like a linkage within the village leader and the people in the village. So this is very efficient system. So in terms of COVID, this group of the people will contact with the village leader that, okay, there will be the member of the village come back from the city, and how many of them. And then when these people come in to the village, they will be at home for 14 days. And these people will coordinate with the people in the village to give them the food, for them to live at home, not go out 14 days, and check the body temperature. If they found that they have something abnormal, they send to the hospital immediately. This is more efficient than the people who live in the city that hard to reach. So we encourage them to go back home and then stay there, and they become more secure in terms of the food security. Hopefully, if they don't come back, they become the new generation of the farmers. Because the farmer in Thailand right now age more than 50 years old by average. And many of them, they have the like son or daughter, or even grandson or granddaughter that go to the city to work. They don't come back to taking care of the farming system. So this one, we hope that this is opportunity that we have COVID, and then we have the new generation of the farmers to get to the village. So
the opportunity during this pandemic, back to village. Okay. Thank you, Dr. The next question for Puriyatno. It is possible we adopt a bartering system like long time ago?
For me?
Yes. Barter system.
Yeah, I think
throw it to you, but I think you have to answer.
Yeah. I think we already, especially in the village, I think the practice is still going on, especially It's not a formal transaction, but people try to exchange. I think that's some kind of barter system. But in the international setting also, in my opinion, it's also possible. For example, you can, we remember the story about buying rice with airplane, remember? Pak Derajat is remember about that.
Not in my generation.
Really? Yeah, when I think it was, when was that, Pak Derajat? I think it was
Early 90s, maybe. Yeah.
early 90s. Yeah,
Yeah.
early 90s when we were at the food shortage, especially rice, and then basically we buy a rice and then we don't pay with money, but we pay with airplane that were produced by Nurtanio at that time. Is that right, Pak Derajat? I remember that. So it's possible.
And the rest is from Professor Visit from Thailand.
Yes. Yeah.
Okay.
Yeah.
So that's
it's
possible.
possible. So,
Thank you.
yeah.
Okay.
Thank you.
So the next question for you: if the COVID-19 is not foodborne disease, how about the raw food that Indonesian people consumption like lalapan? Is still safety?
Yes, I think there's a guideline issued by WHO. Some people worried that so much that they try to wash the produce with a detergent. Yeah, right, But according to WHO, that's not necessary. So you can wash by clean running water, or if you are really, really worried, just to make sure, then you may add a little bit sanitizer, but very little. But again, and then you make it dry, and then you clean them up. But overall, I think, as evidence so far all over the world, that the risk is very low. I did not say that the risk is zero. There is no such thing as zero risk, but the risk is very, very low. Or in other words, the occurring of that kind of transmission is very, very highly unlikely. So that's the word currently being used.
Okay.
Not to mention, I just want to stress that good practice, hygienic practices need to be implemented. So cleaning and then washing your hand and then preparing your food according to the good practice is still has to be there.
All right. Thank you very much, Prof. Another question about infertile eggs for market food legal. How is it related to infertile eggs that were previously banned by the government? But during this pandemic, many people were circulating for consumption because the price were very cheap. What is your opinion?
I'll take that. First, I think there is an issue about we call it food fraud, or food fraud, meaning that there is a honest transaction. You said that this is a good egg, but apparently this is not a good egg. But consumer may not know about that. So there is some kind of dishonest, and then at some point it can be considered as a criminal. So as far as the standard goes, actually that kind of food is out of standard. So we need to be careful. The same thing is, for example, right now I read the newspaper that people trying to engineer or process pork, and then they claim that the meat is actually beef, and that's kind of thing. So this is a food fraud. This is something that need to be eradicated. So not good practice, and many times can be considered as a criminal. Thank you very much.
Thank you very much, Prof. Yeah, I will back again to Prof. Visit. A question for you. Is there a research that describe coping mechanism during COVID-19? We know there is there is a plague problem in food supply decline in community in your country. Coping mechanism during COVID-19. I'm not exactly understand the question, but I hope you catch the question.
Can you repeat again, please? I'm
Okay.
sorry.
Is there a research that describe coping mechanism during COVID-19?
Copy mechanism.
Coping mechanism. Like, I don't know. I don't really understand the question. Okay, just skip the question. Just skip the question.
Okay.
I read all the question already from the Zoom. I don't know, but some of them reach me through WhatsApp, and a lot of them. So, do we still have time, Imas, for read all questions from the participant?
Yes, actually, according to Randon, it's up to 11:30. So it's up to moderator. We still have question from YouTube. Probably you can accommodate the questions.
Wow. So I just opened my WhatsApp. It's kind of 20 questions.
Yes.
Oh my God. So
because we have many audience from YouTube as well. So please.
So I'm referring to the speakers. Would you like to answer all questions? Because not me who answered the question.
Okay.
I like to answer the easy question.
Okay. All right. All right.
Just the easiest.
I will start.
Okay.
So, Prof. which one of food security resources in Thailand that would support the security most in your country in this COVID-19 pandemic?
The food again, please. Sorry.
Which one of food security resources in Thailand that would support the security most in your country?
Thailand is the country that export the food to other countries. Okay, so when we normally, I think we produce surplus basic need already, basic commodities that required for the country. The thing is, we talk about logistics. That can be the problem, and also the panic buying. For example, I give you some example. In fact, the egg production was surplus, and many times we have to try to export a lot because we want to control the price. But after COVID-19, people say that, oh, we are shortage of egg. So people, they bought a lot of egg and take it home. So the egg get out from the market, the price getting like, 3 or 4 times up. And then after that, when the government said that it's no problem because of the people panic buying, then the egg come out again, and then the price go down. And then the one who bought a lot of egg, they just keep it and then become rotten, something like that, because they thought that they're going to have the problem. So in terms of food security in Thailand right now, at this moment, we don't have problem because we have we have the stock, we have the thing that we used to export, and sometimes the export market is not good right now, so the food accumulate. And then the problem is the logistic, that people cannot go to the restaurant, cannot go to the shop, so they have to order buy online, or sometimes they have to be buying from some place that they cannot sit down and eat. I think most of the time right now we are okay with the security, food security. Yeah.
Thank you, Prof. I will back to Pak Derajat again, because you mentioned that until June we still have enough sufficient food. And how about after June?
Okay, thank you. Can I also have to answer the coping mechanism?
Yes, sure.
Okay. First, about the coping mechanism. So there is a common coping strategy implemented by, that's a little bit different between the urban people and also the villages people. In the villages, the most common coping strategies is, of course, if they have a problem with food supply, and they will go to the closest area for the surrounding. For example, what we call as tanaman pekarangan. They can get the money from there. And if there is a shortage also in their home gardening, they will go to the, they always said hutan to get a local name of food such as gadung, etc., etc. That is the strategy. And if they cannot find that way, then the second way is they borrow money from relatives or friends, etc. That is also the one that is practiced in the urban area is borrowing money. And the deeper the problem, then they will sell their assets. That is a very, very general coping strategies implemented. Yeah, in urban area, the first strategy is usually mantap. In bahasa Indonesia, mantap is makan tabungan if they have money in their bank. And after that, they will borrow money from relative, from the closest friends. And after that, they will sell the assets if they cannot find the new jobs. So that is already documented uh, in various studies. And then, okay, I saw you the information regarding the balance foods. Of course, it is from the government sources. It is mentioned that until June, it is we still safe. Our food stock is still safe. As I mentioned before, that we have more than 6 million metric tons of rice until June, and there will be a new harvest time, July to August. That's around 1.8 million metric tons. That means that after June till Augustus, we will have um, around 8 million metric tons. And Indonesian people, we talk only about rice, we consume 2.5 million metric tons per month. So if we have 8 millions, so we have 3.5 months secure our rice. So November to January, we are waiting for the new harvest time. We will lack of rice. So of course, if we can import it, that will be okay. But the problem is Thailand will stop export of rice. You can check to Professor Visit. And I do not know, we still do not know whether Vietnam and Myanmar also follow that. That means we have to, so do not put everything to the government side. Do not put everything to the other people. So we are the consumer have also to aware of that, and we have to change our food consumption pattern also. So that's why food diversification is supposed to be promoted strongly now. So that's why we propose to try to plant anything in your surrounding, the home gardening in urban areas and so on and so forth. Otherwise, we will face problems. So that's why I do hope that it will become our new normal. Eating not only rice, we have a home garden, although it is small. Yeah, eating variety of foods. That's supposed to become a new normal of a healthy lifestyle. Okay.
Thank you, Pak Derajat.
Can I jump in?
Yes, Prof. But I never heard from the government side about the campaign about the food security during this pandemic. I mean, like I never heard kind of, you need to do home gardening, doing something for you to help your family, something like that. I never heard that kind of campaign. So maybe we need to think about this kind of food security in terms of pandemic. Just my suggestion.
Yeah.
Yes, Prof. Please. Yeah.
They do it actually, but of course they are very busy now is in maintaining the stocks, in maintaining the logistic to become normal, etc. But actually they do that. But I think we have to help to make it more sounding, more nationally adopted by every household, by all of us
Yeah.
to diversify our food consumption. And we still have time. November is still 5 to 6 months if we plan everything, no, in our home garden. So
I think we need to start now. I mean, like,
yes, yes.
empower our community to do.
Do not start on November because that is already big problem.
Yes.
Yes.
Thank you, Doc. Okay, Prof. Muryatno, you have something to say?
Yes, thank you very much. There are two things. Number one is that, yeah, I think we have to start now in terms of planting, preparing. But at the same time, we need to have some kind of protection mechanism to the people who do the planting, like the farmer, like the fishermen, and then peternak, to make sure that they are healthy and they will not get any problem related to COVID-19. That is very important because we cannot just say, okay, we need to do or you should do your job, but do it on your own. So we need to be prepared. Government, I think, need to have a specific policy, and they already have some program like Pak Rajat mentioned, but related to the providing specific guideline and also providing some help or assistance regarding how to deal with the COVID-19 is also very important. That's number one. Number two, I'm not nutritionist, but I think this situation, I think Pak Derajat and there are so many nutritionists there, the situation can be used as a momentum to really reduce the number or the amount of rice that we are consuming. Because right now, Pak Derajat quite understand about the number, but as far as I know, we are consume too much rice.
Yeah.
Right now it's around how much? 66% or 67% of calorie coming from rice. And I know
it's more than 50%. Yes.
How much?
That's more than 50% actually.
Yes.
Unfortunately, around 10% addition of calories came from with flour. So that is another new problem. Yes.
Exactly. So this is, I think I'm speaking, from IPB. The rector of IPB has said that this pandemic can also be used as a momentum to, for the food sovereignty or food resilience, things like that. So I just want to add that. Thank you very much.
Yeah. Thank you, Prof. But behavior change it's kind of very difficult things to do. I mean, like it take times, like long time. You cannot educate people like a month to change their behavior, to change their eating pattern. So that's also the issue for the government. And
yes, but for example, washing hand right now, okay, everybody are washing hand very nicely now. Because at the normal situation, it's very difficult to ask people to wash hand, and so it's very much how to use. I'm not the expert on that, but how to use this moment for the betterment of all of us.
Yeah, I agree with you.
That's the idea.
Yeah. So new normal of food consumption. Yeah. Okay. Let's do the campaign. Okay. The next question. Also, no. This for Professor Visit. In which scale percentage recommendation to secure food availability should be applied? It is for household, community, or country?
Again, please. Sorry. How many?
In which scale percentage recommendations to secure food availability should be applied? It is for households, for community, or for country?
In fact, when you talk about food security, right? I just do some project in Thailand we call Zero Hunger program, and in the past we look at the income generation. We look at if you have this income, and if you are above the we call poor level, you are more secure. But in fact, it's not true anymore, because if you look at the now more farmers do in terms of the a very simple one like a household gardening or the new theory of the king. More people practice. If you look at the new theory of the king that the last two slides, people have their own land. They grow whatever they want to eat. So part of the land they grow any fruit tree that they want to eat. They have the ponds for the fish. They can have the for the poultry, for the pigs, and also they have the rice field, small rice field. So in this case, they don't have any cash, don't have any money. So in this case, we cannot tell how many percentage or how much that people have. These people are survive with their own land, with no money. But if they have surplus, they can sell. So income generate a little bit, but not much. So this is thing that different. So that's why this year Thailand, when we talk about food security, we don't look at the like a macro number of production anymore. We used food insecurity experience scale to check for the people, and we use that one as the indicator. We don't say that, oh, we have to produce for example 100% or 110% of the requirement of this one as a macro number anymore. We want people to have in terms of the you have quality and quantity, and in terms of like a diversity of the food. This is very important. So if you try to apply that kind of system, even in small area in your farms, you can have some kind of security by itself. No money involved. So this is the thing that, and the productivity you cannot measure because it's in your own land. So this is the thing that I try to say. It's not because it's not because King Rama the Nice was my king, but this theory have been proven in many areas, and we think in many countries also. So I think that this is a guideline that very effective. So I introduced it because not because I'm a Thai people and he was my king, but I think this is the one that have been proven. I think if you are the agriculturist, you understand it, and it creates security by yourself. You don't have to rely on the market outside so much. Yeah, thank you.
Thank you very much, Professor. All right. Question to Dr. Derajat. If a lot of exporting country is not export their food, there is another way to tackling the food crisis in Indonesia? Question mark.
Okay, so of course, as I mentioned before, that we have to use this opportunity during COVID-19 era to change our policy. First, before we are only taken into consideration to build the food security. What does that mean? In the concept of food security, as already mentioned by Professor, this is the condition that all people have their own access. We do not discuss whether is it from importation or not. But now, in this crisis, we learn that if we rely on importation, and if there is a problem in the other countries, exporting countries, we will have a big problem. So we have to shift from only food security to strengthen our food sovereignty and food self-sufficiency. But it will take a long time to have an effect. So what is in the short period? Of course, the first thing is I mentioned before, we have to try. Just like we do not use, usually we just wash our hand 1 or 2 times a day. Now it's become maybe more than 10 times. So this is the time to change our food consumption. We know that in the market and our surroundings, we have so many kind of tubers. We have so many kind of type of food. And this is not only uses as substitute for the rice, but we have to consider also that for example, the glycemic index is lower. It is more healthier than rice. So with combination of our situation in the shortage of rice and our knowledge that other than rice is also food, it is also healthy, even healthier than rice. We have to combine those of the knowledge and situation to become new people who will ready to reduce our rice consumption and substitute with other food sources. We have more than 72 type of tubers and cereals in Indonesia. People why do not we try to do that? Because We consume 100 kgs rice per year. So make it just reduce 20 kgs. We still alive with 80 kgs. Do not worry. Yeah? But
Alive and well.
we have also, yes, and healthy.
Yeah.
We will still alive and healthy because Thailand people only consume 80 kgs. Malaysian people only consume 85 kgs. They are healthy. So
Mhm.
increase our consumption with other food, and we have it,
Mhm.
and we have it.
Okay. Thank you very much, Pak Derajat. So I think I have read all of the question. Some question is very similar to other questions, so I just skip the question. So this is our final session. I will ask every speaker to deliver 1 minute closing remarks to end the session. So we'll start with Professor Visit. You have any closing remarks? Just 1 minute.
Okay, yeah. I think the COVID-19, okay, is a burden for many countries, but I think it's opportunity for us to rethinking about our own food security in the country. I think it's time that we stay still and we have time to think more carefully and rearrange everything for our life and our in terms of the sustainability for the food security. Thank you.
Thank you very much, Prof. Visit. Okay, next, Prof. Purviatno. You have any closing remarks? 1 minute.
Yeah, thank you. My topic is about the global measures. So I think it is very important to for the country to collaborate because essentially trade is very important, not to make yourself dependent, but more toward the better utilization of the food that has been produced. So if you have really overproduce of certain food, then you need to do the trade, right? So there's some, for example, in our case, we have a lot of palm oil, for example,
Mm-hmm.
a lot more than what we need. So we need to have some kind of trade mechanism, and other countries need that palm oil. So we don't want to make unnecessary barrier to that because ultimately food is the human right of all of the people. So in that sense, but we need to be aware that we don't want to develop some kind of mechanism that will make ourselves, our country, dependent on other country. So this is the one that we don't want to have. Thank you.
Thank you very much, Prof. Okay, the last, Dr.
Okay.
Derajat.
Food diversification programs has been started 60 years ago, and we know people the quality of our food consumption in terms of diversity is very poor.
Mm-hmm.
Okay, so this is the time pushed by COVID-19. This is the time to change. So please, for us, all of the consumers, do not put everything at the government's order. We have to also participate in this situation. So by implementing the food diversification program, it will we will take the benefit also because we will be healthier, and for the government also will be easier, not and no longer to import and so on and so forth. And the second is my message to the government: please support the food diversification program by supporting the uh, production of flour from the tubers, etc., etc., by giving the tax exemption, for example, because we are able to produce what we call as cassava. What is the name, Pak Pur?
Modified.
Modified cassava flour. Yeah, modified cassava flour is like a second quality of wheat flour. But the problem is, it is the government take the tax for that. That's around 11%. When we import the wheat flour, the tax is zero. So please support the local food production, the local food technology to make the the food is available and easily accessible by all of the community. So by doing this, the consumer will change and the government will have a lot of benefits, and the community will healthier as well. Okay,
Oh,
thank you.
thank you very much, all speakers. So this is the time for us, instead of thinking this is a disaster, but this is the opportunity for us. So this is the time. Also, we need to support our local farmers to have food security for the country. So thank you very much. Sorry if I have mistaken before. So over to you, Imas. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Pak Pik. And thank you for all the speakers for sharing the experience with us today. So last but not least, we have some announcement to our participants. Let me show the screen. Okay. So this webinar is part of International Conference on Social Determinants of Health. This event is hosted by Faculty of Health Sciences, Universitas Muhammadiyah Professor Dr. Hamka, with theme Food Security and Implementation of Halal Assurance System Sustainability to overcome the triple burden of malnutrition. This planned to be held in 2021. So actually this webinar is supposed to be held this year, but due to COVID-19 pandemic, we decided to postpone the agenda to be next year. And here are some speakers that already confirmed to join us. But in the future, there's probably some addition in the list of speakers, and you can check the update on our website in icsdh.uhamka.ac.id. So please check it regularly. And this is our social media. You can follow us through our Instagram in ICSDH_official, and the information about webinar materials and certificate will be informed through this Instagram. So finally, see you in 2021. Once again, I thank you for all the participants and all the speakers for joining this event. Thank you very much. And finally, we can close this webinar with Hamdalah. Alhamdulillahirrabbilalamin. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you.
Thank you.
Prof. Paruyatno, Prof. Visit.
Derajat.
Penyakit ginjal lalu disisihkan karena kan kalau penyakit ginjal tidak boleh dikonsumsi.
Ketakutan anak kesendirian ini.
Thank you for all committee who are joining this event. See you.